Welcome back to Daily Dose of Parenting. Today we're continuing our series on red flags in early infant development by discussing a topic that is incredibly important for every new parent: feeding difficulties in babies aged 0 to 3 months. These first few months after birth are filled with rapid growth and development, and feeding plays a central role in their well-being and progress. However, when feeding doesn't go as planned, it could be a signal that something isn't quite right. In this episode, we'll dive into what feeding difficulties look like in infants. We'll explore symptoms such as coughing or choking during feeds, arching the back, showing distress or fussiness, and poor weight gain. Understanding these early indicators is crucial, as they could point to underlying issues that require professional attention. Before we get started, I want to emphasize that the information in this video is for educational and informational purposes only. It is not intended to replace professional medical advice. Always consult with a qualified healthcare provider if you have concerns about your child's health or development. Early recognition of feeding difficulties and swallowing problems is essential, but only a healthcare professional can provide an accurate diagnosis and recommend appropriate interventions. Feeding is one of the earliest and most critical activities for newborns, and difficulties can present as trouble latching onto the breast or bottle, frequent coughing or choking during feeds, dysphagia, or showing signs of discomfort and distress when feeding. Coughing or choking during feeds might suggest problems with the coordination of the muscles involved in sucking and swallowing, which are essential for adequate nutrition and growth. This condition could be linked to a range of issues, including neurological disorders, structural abnormalities like a cleft palate, or gastroesophageal reflux disease, GERD. Persistent feeding difficulties can lead to poor weight gain, dehydration, and failure to thrive, all of which require immediate medical evaluation and intervention. As we go through these important points, I will mention some carefully selected products that I believe can be truly beneficial for parents facing these challenges. These are available on Amazon, and you'll find the affiliate links in the description box below. Purchasing through these links comes at no additional cost to you, but it helps the channel grow and allows me to continue creating content that supports your parenting journey. I've chosen these items based on their quality and usefulness to make your experience as a parent a little easier. Latching difficulties are one of the main concerns in newborns and can stem from a variety of causes, ranging from anatomical issues and developmental delays to environmental factors and maternal challenges. Understanding these underlying causes is crucial for identifying effective solutions and ensuring both the baby and mother have a positive breastfeeding experience. One of the most common causes of latching difficulties is a tongue tie, ankyloglossia, where the frenulum, the band of tissue under the tongue, is too short or tight. This restricts the tongue's movement, making it hard for the baby to extend the tongue properly to achieve a deep latch. Babies with a tongue tie may experience pain during feeding, produce clicking sounds, or show signs of frustration due to inadequate milk intake. Similarly, a lip tie can cause problems. A lip tie occurs when the upper lip's frenulum is too tight, preventing the baby from flanging their lips properly around the breast, which is essential for effective suction. Other anatomical issues include a cleft palate or cleft lip, where the structure of the baby's mouth is abnormal. These conditions prevent the baby from forming a good seal around the nipple, making sucking and swallowing difficult. I experienced this firsthand with my own daughter. She was born at 36 weeks of gestation during the first COVID-19 wave in April 2020. A big, very hungry baby, but with a very short frenulum. Due to the pandemic, her frenulotomy, a procedure to release the tongue tie, was postponed, which made breastfeeding particularly challenging. To help her latch, I used the Medela Contact Nipple Shields, which provided a better grip and facilitated more effective breastfeeding despite the tongue tie. These shields are specifically designed to help with latching problems and are recommended for mothers who have flat or inverted nipples or whose babies have difficulty latching. They can be very helpful when used under the guidance of a lactation consultant, as they allow babies to latch more securely and feed more effectively, ensuring they receive adequate nutrition. Babies born prematurely may face additional challenges when it comes to breastfeeding and swallowing. Premature babies may not have the muscle strength, coordination, or stamina needed to maintain an effective latch for an extended period. Their sucking reflexes may be weaker or less developed, which can lead to ineffective feeding and weight gain issues. Dr. Brown's Natural Flow Preemie bottle is specifically designed for babies with feeding challenges, including premature infants. It includes specialized slow-flow nipple to accommodate the weaker suckling of premature infants. The bottle features a vent system that reduces air intake, which can help minimize gas, burping, and colic. The slow flow also helps prevent the baby from choking or getting overwhelmed by the milk flow. Neurological conditions can also impact a baby's ability to latch properly and make the whole feeding process difficult. Conditions affecting muscle tone, such as hypertonia, low muscle tone, or hypertonia, too much muscle tone, can make it hard for babies to maintain the necessary strength and coordination for feeding. In my case, I needed to pump my breast milk regularly to ensure my daughter was getting enough nutrition. I tried various electric breast pumps, but I found that they did not work well for me. I relied on a manual breast pump, which allowed me more control over the suction and was easier on my body. The Medela Harmony manual breast pump was my go-to because it was simple to use, quiet and portable, making it easy to pump anywhere. Manual pumps can be an excellent choice for mothers who find electric pumps uncomfortable or for those who need a more portable option for occasional pumping. For babies experiencing discomfort due to gastroesophageal reflux, maintaining the correct position during and after feeding is crucial. GERD occurs when the contents of the stomach flow back into the esophagus, causing irritation and discomfort. In infants, this can manifest as frequent spitting up, vomiting, irritability during or after feeding, arching of the back, coughing, or even refusing to eat. GERD can significantly impact a baby's feeding and overall well-being, as the discomfort associated with acid reflux can lead to feeding aversions, inadequate weight gain, and disrupted sleep. The underlying cause of GERD in infants is often related to the immaturity of the lower esophageal sphincter, the muscle that acts as a valve between the esophagus and stomach. In babies, this muscle is not fully developed, making it easier for stomach contents, including stomach acid, to back up into the esophagus. Other contributing factors can include overfeeding, swallowing air during feeds, or underlying conditions such as food allergies, delayed gastric emptying, or anatomical issues. Managing GERD involves a combination of positioning strategies, feeding techniques, and sometimes medical intervention. Maintaining an upright position during and after feeding is one of the most effective ways to manage GERD symptoms in infants. Keeping the baby at a slight incline helps reduce the likelihood of stomach contents flowing back into the esophagus, thereby minimizing reflux episodes. It is important to stress that infants with reflux aged 0 to 3 months should also follow the ABCs of safe sleep. A for alone, no objects in the crib; B for back, sleeping on their back; and C for crib, a firm flat surface. The American Academy of Pediatrics, AAP, a leading authority on child health, advises against using products like wedges, sleep positioners, and inclined or rocking sleepers, as these are not approved for safe sleep. Fisher-Price's popular Rock and Play was recalled in 2023 due to safety concerns, as these types of products may increase the risk of sudden infant death syndrome. Although this episode isn't specifically focused on safe sleep practices for babies, I want to take a moment to share my opinion on wooden cribs for newborns. While wooden cribs are a popular choice for many parents, I wouldn't recommend them for newborns. Newborns can accidentally bump into the hard wooden slats, which can cause discomfort or minor injuries. To mitigate this, some parents might think about adding cushioning or padding around the crib. However, this is against the American Academy of Pediatrics, AAP, recommendations, as any added soft materials increase the risk of suffocation and sudden infant death syndrome, SIDS. For this reason, safer alternatives like the Graco MyView 4-in-1 bassinet are worth considering. It provides a secure, flat and firm sleep surface with breathable mesh sides that align with AAP guidelines, reducing risks while ensuring comfort for the baby. This versatile crib is designed for infants from birth up to around 12 months, or until the child begins to push up on hands and knees or exceeds the weight limit of 15 pounds, for bassinet mode. The crib can function as a bedside sleeper, bassinet, portable bassinet, and crib, providing flexibility and convenience for parents. For babies with GERD, it's also important to use smaller, more frequent feedings to avoid overloading their stomachs, which can help reduce the chances of reflux. Burping the baby more frequently during and after feeds can also help minimize the amount of air swallowed, which contributes to gas and reflux. According to the current pediatric gastroesophageal reflux clinical practice guidelines, thickening infant feeds is recommended as a first-line approach for managing frequent regurgitation or spit-ups associated with GERD. However, it is important not to use infant oat milk or rice cereal for thickening, as often recommended. These are not suitable for babies under 6 months and may pose a choking risk or cause nutritional imbalances. Always consult a pediatrician or a pediatric gastroenterologist for safe, appropriate thickening options. When dealing with feeding difficulties in infants, having the right resources and tools can make a significant difference for both parents and babies. Understanding the underlying causes, recognizing the signs, and implementing practical solutions are key steps in overcoming feeding challenges. For this reason, I recommend 2 helpful books that can provide guidance, support, and valuable strategies to parents navigating these issues. If your baby has bottle feeding difficulties, books like Your Baby's Bottle Feeding Aversion: Reasons and Solutions by Rowena Bennett offer comprehensive advice on identifying and managing feeding aversions. This book helps parents recognize the signs of feeding difficulties and outlines step-by-step methods to overcome them. For breastfeeding challenges, The Nursing Mother's Companion 8th edition by Kathleen Huggins is a classic guide that addresses common concerns such as latching problems and dysphagia. It provides practical strategies to ensure an adequate milk supply and to manage any difficulties that arise during breastfeeding. This book is particularly useful for mothers looking to navigate the complex journey of nursing with confidence and skill. In addition to these books, there are several tools that can assist parents in tracking and managing feeding routines, ensuring that their baby is getting the right amount of nutrition and developing healthily. Tracking feeding routines and other daily care activities is crucial for babies with feeding issues, as it helps parents monitor their baby's nutrition, identify patterns, and spot potential problems early. Consistent tracking provides valuable information that can be shared with healthcare providers, such as pediatricians or lactation consultants, to better understand the baby's needs and develop an appropriate feeding plan. Properly documenting feeding times, amounts, diaper changes, and sleep can be a vital tool in ensuring that babies with feeding challenges receive the right care and support. To assist with this, the Tali Baby Tracker is an excellent digital solution designed to help parents easily monitor various aspects of baby care, including breastfeeding, pumping, bottle feeding, diaper changes, sleep, and more. This device allows for one-touch tracking of multiple daily activities and syncs data to a smartphone app, making it simple to review and share information with healthcare professionals. The Tali Baby Tracker is particularly useful for parents who want a straightforward electronic method to stay organized and ensure their baby is getting the proper care. However, if you prefer not to purchase a separate device, you can use just an app that offers similar tracking features. There are many apps available, such as Baby Tracker, Newborn Log, Glow Baby, and Sprout Baby, which provide comprehensive tools to monitor your baby's feeding, sleep, and development directly on your smartphone, and are available on Google Play Store and Apple App Store. For parents who prefer a more traditional approach to tracking their baby's daily routines, Baby's Daily Log, Feeding, Sleeping, Diapers provides a paper-based option. This journal allows parents to easily log feedings, naps, and diaper changes by hand, making it particularly helpful for those who prefer a tangible written record that can be easily referenced or shared with caregivers or pediatricians. Alternatively, parents can simply use a regular diary to jot down daily feeding routines and observations. Keeping a dedicated notebook or diary can be just as effective in tracking important information and staying organized without the need for digital devices. Feeding difficulties in infants aged 0 to 3 months can be a challenging experience for parents, but recognizing the signs early and knowing what steps to take can make all the difference in ensuring your baby's health and well-being. In this episode, we've covered various causes, from latching difficulties to gastroesophageal reflux, and provided tips and resources to help manage these issues effectively. As mentioned earlier, some carefully selected products that can assist with feeding challenges are available through affiliate links in the description box below. By purchasing through these links, you support the channel at no extra cost to you, enabling me to continue creating helpful content for parents like you. In the next episode of our series, we will be discussing persistent jaundice in newborns, a condition that affects 15% of all newborns. We'll talk about the causes, symptoms, and when to seek medical advice to ensure your baby stays healthy and thriving. So stay tuned and make sure to subscribe to Daily Dose of Parenting for more episodes in our series on red flags in early infant development. If you found today's discussion helpful, please give this video a thumbs up, share it with other parents, and let me know your thoughts in the comments below. Thank you for watching, and see you in the next episode.